Hey everyone, and welcome. I am absolutely thrilled to have you joining us today. We're going to unpack a topic that is profoundly important for our long term health, our overall vitality, and honestly, our peace of mind. Today's explainer is all about a condition known as atrial fibrillation, or as you've probably heard it called, AFib. Now, I know jumping into medical topics can sometimes feel a bit intimidating, but I promise you, this is a highly empowering explainer all about protecting our hearts and our brains. By the end of our time together, you're going to have a crystal clear understanding of exactly what this condition is, how it secretly threatens us, and most importantly, how we can proactively protect ourselves. So let's get started. Okay, let's dive into this. Here is our roadmap for today. We'll start with the hidden arrhythmia threat, then cover what is atrial fibrillation, move into the dangerous stroke connection, look at identifying key risk factors, and finally wrap up with prevention and stress management. And hey, I want to reassure you right up front, while we are definitely going to discuss some scary stroke risks today, we are absolutely going to finish up with some highly actionable, calming prevention strategies. Let's start with Section 1, the hidden arrhythmia threat. To understand what goes wrong, we first need to establish exactly what a normal, healthy heart does. Think about this number for a second, 100,000. A healthy human heart is an absolute marvel of biological engineering. Under normal conditions, your heart is beating in a perfectly regular rhythmic pattern, roughly 60 to 100 times every single minute. When you zoom out and look at a full 24-hour period, that means your heart is beating a staggering 100,000 times a day. It does this flawlessly, day in and day out, to supply your entire body with vital, oxygen-rich blood. But sometimes that perfect rhythm gets disrupted. When that rhythm breaks down, we call it an arrhythmia, which simply means an irregular pulse. But here is the critical distinction we need to make right off the bat. Not all irregular heartbeats are created equal. On one side, we have benign arrhythmias. You might feel a skipped beat or a flutter, but medically speaking, they are often harmless and perfectly safe to just leave alone. On the other side, however, we have malignant arrhythmias. These are the bad guys. These require immediate medical evaluation and treatment. And atrial fibrillation? Well, it falls squarely into this malignant, dangerous category. It is a condition that absolutely must not be ignored. That brings us to Section 2. What is atrial fibrillation? Let's take a look inside the chest and see exactly what's happening. Your heart actually has 4 distinct chambers, 2 lower ones and 2 upper ones. The upper chambers are called the atria. In a healthy heart, these atria give a strong, forceful squeeze to push blood down into the lower chambers. But in atrial fibrillation, that strong squeeze completely disappears. Instead, the electrical signals in the heart go completely chaotic, causing these upper chambers to merely quiver. They just sort of twitch in small, erratic, rapid movements. And because they are just quivering and not efficiently squeezing, the blood isn't being pushed forward properly. Instead, it starts to dangerously stagnate and pull right there inside the chambers. And this brilliantly illustrates exactly what we're talking about with this doctor's river analogy. Think of the blood flow in your heart like a curving river. Where the river water flows fast and powerfully around a curve, the water stays clear and clean. But what happens in the slow-moving areas at the edges? The water pools, it stagnates, and it becomes muddy and murky. The exact same physics apply to your blood. When the atria just quiver, the blood pools and stagnates. And in the human body, stagnant blood creates the absolutely perfect environment for a blood clot to form. Section 3, the dangerous stroke connection. Because ultimately, those clots are the true weapon of this condition. Let's move to and see how this builds into a terrifying chain reaction step by step. Step 1, the atria quiver instead of pumping. Step 2, the blood pools and stagnates in those upper chambers. Step 3, because of that stagnation, a large blood clot forms. And then, the most dangerous moment, Step 4. The heart gives a beat, and it forcefully ejects that clot out of the chamber. Where does it escape to? Well, anatomically speaking, the very first major exit ramp from the heart leads straight up to the brain. The clot shoots out and travels directly into the cerebral blood vessels. The data on this is just stark and undeniable. If you have atrial fibrillation, your risk of suffering a stroke increases by roughly 5 times compared to someone with a normal heart rhythm. It is a massive risk multiplier, simply because your heart is actively manufacturing clots right next door to the brain. So the crucial point is this. We aren't just talking about a higher frequency of strokes, we are talking about a vastly different severity of stroke. Some strokes are caused by tiny blockages in the brain's small capillaries, resulting in smaller localized damage. But clots formed by AFib, they're usually very large. Because they are so big, when they travel to the brain, they don't get stuck in the tiny capillaries. They get lodged in the massive main root vessels of the brain. This completely cuts off blood supply to huge portions of brain tissue, resulting in massive, devastating damage that very often leaves the patient requiring permanent nursing care. Now, while those massive strokes are absolutely the primary threat we want to avoid, we should briefly mention the secondary problem here. Because the heart's electrical system is chaotic, patients often experience a wildly fluctuating pulse. It might suddenly race, causing uncomfortable, frightening palpitations, or it might drop far too slow, leading to severe dizziness and instability. These physical symptoms severely impact a person's daily quality of life. Let's shift from the problem itself to Section 4, identifying key risk factors. Who exactly is most at risk for developing this? The single biggest factor is simply time. The heart runs nonstop, and over decades, it just experiences natural wear and tear. So age is a major component here. When we look at populations over the age of 75, roughly 10 to 20%, averaging around 15%, either have atrial fibrillation or are highly prone to developing it as the heart wears down over time. Now, what's really interesting about this slide is the other specific risk factors. High blood pressure, heart failure, and valvular disease all directly stress the heart muscle. But look at the last two, sleep apnea and hyperthyroidism. Sleep apnea is particularly insidious. People who stop breathing in their sleep are constantly depriving their bodies of oxygen. This oxygen starvation puts an immense, suffocating strain on the heart. Similarly, an overactive thyroid, hyperthyroidism, floods the body with hormones that overstimulate the heart. Which brings us to our final and most important part, Section 5, prevention and stress management. Let's look at how you can protect yourself. Look, we can't stop the clock and we can't stop aging, but practically every other risk factor here is entirely within our control. If you have thyroid issues, you can work with a doctor to medically control those hormones. You can take medication to manage your blood pressure. You can get treatment for valvular disease. If you have sleep apnea, using a CPAP machine and addressing obesity removes that nightly oxygen starvation. It all comes down to proactively addressing these individual lifestyle factors with medical help, maintaining a healthy diet, and getting regular exercise. Doing these things drastically lowers your risk. But there is one more critical piece of the puzzle that often gets overlooked. Your mental state directly impacts your heart's electrical system. High stress, chronic anger, and severe emotional ups and downs don't just feel bad in your head. They physically overactivate your sympathetic nervous system, your autonomic fight or flight response. This constant rush of stress hormones puts an immense, exhausting burden on your heart's rhythm. You can eat all the right foods, but if you are constantly furious and stressed, your heart is literally still under attack. Which leads me to this final, essential question to leave you with today. Are you living a heart-friendly, calm life? Medical treatments and diet are incredibly important for sure, but a calm, stable mind is quite literally a shield for your heart. Managing your stress and finding peace isn't just a luxury, it is a vital medical strategy for preventing atrial fibrillation. So take a deep breath, take care of your stress, and your heart will thank you for it. Thank you so much for joining me for this explainer, and until next time, stay curious and stay healthy.